Welcome to Nurturing New Life. I am your host, Dr. Vita, and today we are stepping into that beautiful, hazy, and sometimes overwhelming first week of life with your newborn. There is truly nothing in this world quite like that new baby smell, or the way those tiny fingers wrap around yours for the very first time, is there? If you are listening to this and you feel exhausted, perhaps even a little teary, please know that you are doing a wonderful job, and it is perfectly normal to feel this way. Today, we are going to walk through the essentials of these first 7 days, from the feeding marathons to the sleep cycles and those vital first trips to the pediatrician. Let us start with the topic on every new parent's mind, feeding, because it feels like it never stops, doesn't it? Newborns need frequent feeding, usually every 2 to 3 hours, because their tiny stomachs are only about the size of a marble on day 1. Whether you are breastfeeding or formula feeding, this frequency is crucial for their growth and, in the case of breastfeeding, for helping your milk supply establish itself. You might notice something called cluster feeding, where your baby wants to eat every hour for a few hours in a row, often in the evening. It is not a sign that you do not have enough milk. It is actually nature's way of telling your body to produce more and a way for your baby to find comfort. Watch for those hunger cues, rooting, sucking on hands, or smacking lips, rather than waiting for them to cry, which is often a late sign of hunger. Now, let us talk about the elusive dream of sleep, which feels like a distant memory during this first week. I know. The phrase sleep when the baby sleeps is easier said than done when you have laundry, dishes, and your own healing to manage. Remember the ABCs of safe sleep: alone, on their back, and in a crib or bassinet that is free of blankets, pillows, or toys. Their sleep patterns will be erratic because they haven't developed a circadian rhythm yet. They don't know the difference between noon and midnight. Keeping the environment dim and quiet during night feeds can help them eventually learn that nighttime is for resting, while daytime is for engagement. Moving on to our first big outing, the first pediatric checkup, which usually happens within 2 to 3 days of leaving the hospital. Do not be alarmed if your little one has lost a bit of weight. Most newborns lose about 7 to 10% of their birth weight in those first few days. By the end of the second week, they are usually back to their birth weight, and your pediatrician is there to ensure that trajectory is healthy and strong. During this visit, we check for jaundice, which is that slight yellowish tint to the skin or eyes, and we listen to that beautiful, fast-beating heart. It is a time for you to ask every single question you have written down, no matter how small or silly you think it might be. Let's touch on vaccinations and screenings, which are the silent shields protecting your child from the very start. In the hospital, your baby likely received their first hepatitis B vaccine and a vitamin K shot to prevent serious bleeding issues. That little heel prick test you saw, that screens for dozens of metabolic and genetic conditions, allowing us to intervene early if anything is found. These steps are the foundation of a lifetime of health, and they are some of the most important gifts you can give your newborn. As we wrap up, I want you to take a deep breath and look at that precious life in your arms or sleeping nearby. This week is about survival, yes, but it is also about the beginning of a bond that will define the rest of your lives. Be kind to yourself, lean on your support system, and remember that you are exactly the parent your baby needs. Thank you for joining me in the studio today. I am Dr. Vita, and I am sending you so much love and strength for the days ahead. Until next time, keep nurturing that beautiful new life.